This episode of The Dog Show features Dr. John Morgan. John is a partner veterinarian at Gordon Vet Hospital, an independently owned vet practice that has been operating since 1971. After developing an interest in animals at a young age, John studied veterinary science at Sydney University before eventually finding a home at Gordon Vet Hospital, where he specialises in orthopaedic conditions and arthritis. In the interview, we discuss the most common reasons a dog needs surgery, how to prepare your dog for surgery, and the risks you should be aware of. John, welcome back to the Dog Show again today. Thanks for coming on.
Thanks for having me, Will. Pleasure to be here.
Great. So today we're going to talk about surgery, so dog surgery. I know it's quite a broad topic, but you've got a lot of experience in that space. So I'm interested to hear. I'm sure there's lots of people out there that may be thinking about surgery. Maybe they're being recommended surgery by their vet, or maybe in the future they're going to have that come up as well. So I think it's an interesting topic to cover.
Yeah, and it's really, really broad, and I think obviously people extrapolate from their own experiences of surgery, and often are reluctant to go there. But to be honest, these days with modern veterinary surgery, I think it's extremely safe and something that people should be much more comfortable with.
I'm sure there's probably questions that, a good vet's going to be asking the owner, but the owner should be asking questions as well.
I always encourage, obviously, a little bit of pre-research and making sure that, obviously the vet that you're getting to do a certain surgery is actually not only qualified in that space, but also has the requisite experience. So if you're not feeling comfortable, or if obviously you want to have that chat, it's not offensive to us if you do say, look, are there other options, or is this something that you've done a lot of before? Because, obviously we all have different experience levels, and it's an important question to ask.
So what are some of the most common surgeries that a dog owner might face in their dog's life?
So probably the most common, obviously, is desexing procedures. So castrates and spays, as they're more colloquially known as. And they're essentially, every dog should or is likely to experience that. And again, extremely safe, really, really low mortality rates with anaesthesia, which people get scared of. We really don't see that in practice anymore. The old school days of death under anaesthetic really doesn't happen.
Yeah, so the anaesthesia one, that's an interesting one to move on to, because I guess a lot of people are unsure about if it's safe. They've probably heard horror stories at some point about, dogs not coming out of surgery okay. So yeah, do you want to tell me a bit more about anaesthesia, how that process works and how you do control that situation?
Yeah, so I won't say that no dog has ever died under anaesthetic, or it won't happen again, because unfortunately it is always a risk, and I do always counsel clients about that. However, these days the rate of that occurring is exceptionally low, and we feel with modern techniques and modern drugs that not only do they not feel anything during these surgeries that often have to be performed, they're recovering really well, and that pain is almost non-existent to them, which is sort of what we aim for.
Okay. So what does it look like coming out of a surgery for a dog after having anaesthesia? Are they a bit druggy, what's the word I'm looking for?
Drowsy or
drowsy?
Yeah. So the aim of anaesthesia, or modern anaesthetic techniques, is to take a multimodal approach, which basically means that we use a safe combination of drugs, but the more drugs, often the better for pain relief. So dogs will have an anaesthetic sedation beforehand, as well as a pain relief, which is usually an opioid. And then they'll be induced with a drug that actually puts them to sleep. That combination of drugs basically get them to the point where we can put them on gases in most cases, which obviously with a tube, so often there is an endotracheal tube passed, so they can breathe 100% oxygen with a drug in that oxygen that actually keeps them anaesthetized.
And how long would they be under for, let's say, for example, in a desexing operation?
Yeah, so for your castrate for dogs, probably less than half an hour from when we induce or when we put them under anaesthesia to when they recover. For a dog spay, it's usually about an hour. And then for dental procedures, it is a bit of a range between half an hour to potentially 2 hours if there are a lot of teeth that have to be removed.
Okay, so they can be under for a couple of hours safely.
Yeah, quite safely. And you've got to remember that obviously we tailor the anaesthesia protocol to the length of the procedure. So we don't just use a one procedure fits all approach. We definitely do choose our drugs very wisely based on the length of the procedure, the age of the animal, and what we obviously wanting to get out of surgery. In the case of a longer procedure, we do have to look at other factors. So we actually provide external warming. We provide intravenous fluids, or basically rehydrate them with a drip. And in a lot of cases, we do look at even referring. If it's really complicated cases, sometimes it's best to speak to a specialist anaesthetist if there's underlying conditions or in really old or unwell animals.
Is that the case for some breeds? Because I've heard some of the flatter face breeds may have trickier anesthesia experiences.
Really common with obviously we do have a bit of a trend in what we call brachycephalic.
I couldn't pronounce it, that's why I didn't say that.
I still got it. Brachycephalic breeds are a particular watch zone. We've got to be really careful with their anesthesia. We've actually got to keep the tube in, or the endotracheal tube in, for a lot longer after anesthesia, and we have the nurses often with the vets watching them like a hawk on recovery, because of their smaller airways and because of their difficulty breathing, it's really important that they're almost standing before we remove that tube.
So I guess that's a good question that an owner could ask a vet about their experience with those particular breeds.
Exactly, yeah. And at Gordon Vet Hospital, where we do see a lot of them and we're very experienced in that, we actually, one of the other vets there provides the airway surgery to actually open up the airways. Which means that we do have a lot of experience in that breed, but a lot of vets don't, and it's often worth just asking that question.
Yeah, absolutely. So do you always keep like a dog overnight after a surgery, or does it depend on the surgery?
Very much depends on the surgery. Depends on the vet, and often it depends on the owner. So orthopaedic procedures, we almost always keep them in overnight, just because, as you mentioned, they're quite drowsy after a procedure. We don't want them sort of, doing something that they would normally do under the effects of a sedation drug, and potentially injuring a leg that they've had surgery on, and obviously making things worse. We often just have them confined in a small space for that 24-hour period afterwards, or to keep them on the required pain relief. Another example might be your de-sexes or your dog spays and dog castrations. They actually can go home in most cases that day, pending if there were any problems during surgery or anaesthesia, but in most cases they're fine to go that afternoon.
Yeah, I always think that's the challenge after a surgery, isn't it? Keeping your dog confined, especially if it's a younger dog or something, they're high energy. So having them in there for at least a day to get that recovery time is probably good.
Exactly right, yeah. We're fortunate here with modern medicine, modern veterinary medicine. We do have drugs that actually can be used for those more high energy breeds. So additional oral sedation actually is used in a lot of our cases where we do want to keep them confined and relaxed for about 7 days to stop dog owners from going completely mad.
Yeah, so what does recovery look like for an owner? Let's say, for example, we'll go with desexing, but also maybe an orthopaedic condition as well. We'll do 2 examples. So after a desexing, what does the next couple of days or couple of weeks look like for the owner?
Yeah, so again, depending on the condition, but in most cases they will be drowsy for at least the first 24 hours. And then after that, they largely are a bit tender. Unfortunately, while we do our best to control all pain, they can feel a little bit. So they'll often try and do something that's beyond their ability at the time, cause a small amount of pain, and then sort of react to that, or just be a little bit shyer than they'd normally be. Again, depending on the procedure. For procedures like castrations, we often have the opposite problem. They're often too active, and the pain of the castration procedure is fairly minimal, and they're actually too active afterwards, which is often a testament to the skills of your vet, but also the fact that it's hard to control these dogs sometimes.
With the castration or the desexing, do they usually have to wear like a cone home or any of that kind of stuff?
Yeah, that's sort of practice dependent. At Gordon Vet Hospital, we do put a cone or an e-collar on every patient, but that's something you should discuss with your vet, and it's something that we usually find that they will lick the wound. The common misconception is that licking of surgical wounds is good because it cleans the wound. I've heard quite a few times. It's actually the opposite. A dog's mouth, unfortunately, is loaded with bacteria, and if that bacteria gets anywhere near a wound, we do open up the door to what we call post-operative infection, which can cause really major issues.
Well, that's good to know because I let my dog lick me. So
Yeah. No open wounds, Will.
no wounds. But I haven't got sick yet from it. So
No,
it should be okay.
Keep it up there.
Interesting though. I mean, when Frankie, our French bulldog, got desexed, she didn't have the comb, but I think she can't reach the area.
Yes.
Which is another thing.
And again, the brachycephalic or flat-faced dogs, you might not have as big an issue with it. And some dogs will never bother a wound, but in my experience, probably about 75 to 80% will have more than 30 seconds of licking. So it's something you want to watch out for.
So I guess, what would you recommend? I mean, you said kind of the experience the dog has after surgery, but what would you recommend to me as the owner? Do I need to keep them kind of penned in? Do I need to be monitoring them 20? Like, what kind of advice do you give the owners?
Yeah, I think again depending on the procedure, but I think most of the routine procedures like dentals, desexing procedures, and small lump removals, those kind of things, the risk factors post-operatively are pretty low. Watching them for 24 hours is usually unnecessary. And your vet should advise you, if they need 24-hour monitoring, it really shouldn't be done at home anyway.
Yeah.
They're often actually better to go to an emergency clinic to have that done. But in most cases, I tell people that a penned area is probably a really good idea, just again to narrow how much they can move around. And reduced food. A lot of people try and feed them as much as possible after surgery, but that can cause issues. They often vomit that back up when they're feeling a bit nauseous. And the other thing would be definitely trying not to get them back to activity as quickly as you'd think. So try and avoid long walks or the dog park for at least a week until the vet's given you the okay.
Well, I guess that's if that's part that goes with the food, right? They also need to eat less because they're exercising less.
Exactly right.
Weight management.
Yeah, it's a big part of the weight management, and we do discuss that in a lot of our orthopaedic conditions. So we always say make sure you're feeding them less than you normally would because they're not exercising and because they're not even roaming around their range as much as they normally would. And weight gain after orthopaedic procedures is a big no-no. We actually want to go the other way.
Okay, so I trust you as a vet, and I trust the Gordon vet because I've been there for Frankie's whole life. But I'm sure there are some vets out there, from the people that have been exposed to that are listening now, that maybe don't have as high quality practice in terms of surgery and things like that. What questions could I ask to get confidence in that I'm with the right vet, someone that I can trust to do surgery?
Yeah, and that's a really tricky one. Because often, vets don't know their own limitations or aren't being transparent about their limitations. I think the biggest question you could ask is how many of these have you done before? Or even getting a recommendation from another vet. Unfortunately, obviously, we do get a little bit overconfident in certain cases, and so questions from owners should be asked. And also, if sort of your funding is available to it, then the option of going to a specialist should be considered in really complicated procedures, or offered if the vets don't feel comfortable in that space. So, really asking those questions and making sure you get a sense for what they're like is really important. But of course, personal recommendations from people that have used the vet before is always a good option. Yeah,
I think that's when you're going to feel the most comfortable. If you've spoken to another couple of owners, maybe similar breeds that have gone through the process at that vet, that's going to give you confidence.
Exactly right. Yeah, because there are certain procedures that I won't go near, and I think that even if it's internal referrals or meeting another vet within the practice or potentially going elsewhere, it should be considered for non-emergency procedures, and often just about sort of getting that clarity from your vet. We do find that the most issues that we have actually come from a lack of communication. So having the time and asking those important questions is really vital on both sides.
How often are you doing surgeries?
I am probably doing surgery 2 times a week at the moment.
Okay.
And that is in one of the days at least would be fairly large chunks. And then obviously we do get the occasional emergency procedure that I have to get involved in.
Okay. And how do you get, this is a random question, but how do you kind of get prepped for surgery? Is it different to a typical day for you, or?
So we have the morning of consults, so we can sort of focus on that. And we want to make sure that we're giving these patients our full attention, because it's not just like jumping in the car and going for a drive. You do have to get into a bit of a space. For the longer, more complicated procedures, I always grab a banana have a coffee to make sure the senses are tingling.
Yeah.
But yeah, everyone's a little bit different. Some people like the music blaring, but
Oh yeah.
yeah, I found that it just throws me off, and I get frazzled, and I tell them to turn the music off. But a lot of people like their favourite tunes when they're doing procedures.
I imagine the concentration and it takes a lot out of you, those like doing an actual surgery.
Yeah, and I mean, you know, it is. There's often a lot going on as well. So we're fairly blessed at Gordon Vets. We have sort of isolated theatres.
Yeah.
So you do have that little bit of zen that you need for the more complicated procedures. But yeah, I mean, in a lot of busier days, you know, you'll get nurses sort of nurses or receptionists asking you questions, and you sort of have to say, I'm doing this procedure. It does need my full focus. You're gonna have to leave me a message.
Yeah. Imagine it's like, as you said, it's kind of a zen space for you. If you can get into that zone, almost like being on a run or a swim or something.
Exactly,
just
yeah.
Zone out and just get the job done.
Yeah, and I mean, some of the, because I've been practicing as a vet for 13 years now, so your more common procedures like castrates and spays, you know, you often just do them without thinking sometimes. It just becomes almost like muscle memory. But there are really some different niche surgeries that I do within my sort of expertise that do require my full focus, or definitely are a little complicated where I have to sort of sit down and really think about it. The other thing that's important for me as well is just to read up on the procedures that I'm less familiar with, spend a bit of time going through textbooks and making sure that my approaches are all going to be accurate, which, yeah, most vets will definitely revise how they look at surgeries and make sure that they're comfortable doing them.
Cool. Well, that's good to know. John, thanks for talking about surgery on today's episode. If I had to summarise in one word, the best approach for an owner to take towards dog surgery is communication, I think.
100%. Yeah, communication all the way.
Cool. Thanks, John.
Thanks, Will.